All right, let's go ahead and look into the case of Jeff. So, Jeff, it looks like he is a 27-year-old male. He's married and has been an attorney in a large law firm for about 2 years, where he specialized in business law. So here we have an attorney, kind of mid to late 20s. So let's figure out what's going on here. Looks like he is originally described as mild-mannered, somewhat reserved, and friendly. So that seems kind of pretty functional to me. Looks like he's functioning in his job, so we might as well identify that. It looks like he's an attorney in a large law firm for 2 years, which means pretty solid work history. He's a professional, so at least hopefully some level of intelligence in a large law firm. So let's figure out what the symptoms are. It says it looks like his colleagues noticed that he has suddenly become increasingly talkative, okay, and outgoing when he is around them. So that's kind of interesting. Folks that these type of symptoms get really kind of, for me over the years, when a person is becoming increasingly talkative, let me change that, increasingly talkative and outgoing, some of the few disorders that talk about like increased becoming outgoing, talkative, speech. We're dealing with stuff with disorders potentially, and I'm going to write these down as possible kind of rule outs. Are things to consider would be such things right now as bipolar. Let's see, even some form of schizophrenia, if it's a type where they become very talkative, they're talking to anybody. Now obviously paranoid schizophrenia is not going to be doing any of that really, but other types of schizophrenia where it's disorganized or whatever, that might be the case. Other types of conditions that might increase talkative might be such things as maybe even like histrionic personality, or even kind of borderline. Maybe even like ADHD. Can be pretty talkative and pretty interactive, possibly even outgoing. So let's kind of maybe go down. Those are just some things that pop into my mind as far as that deal with speech and being talkative and possibly even being kind of outgoing. So let's continue on here and see kind of what's happening with this guy Jeff. So it looks like, and again, probably the key word here, and I'm going to highlight this in blue. He has suddenly. So his colleagues notice that he has suddenly become increasingly talkative and outgoing, and that's a key phrase there too, because this really is a stark change, it appears, from what he was described as mild-mannered and reserved and friendly. So this is another word for sudden. When we talk clinical terms, we're talking about an acute incident, really something that all is out of the blue, really hasn't been bubbling up or manifest really before. So this is really an acute situation. Okay, so let's jump back. And it looks like, let's see, he was outgoing, he was making others laugh by cracking jokes, doing impersonations, and singing lines from musicals. So this right here, this appears to be what I would term, when we're talking about cracking jokes, singing lines, making others laugh, when he was previously mild-mannered. So this seems really uncharacteristic of him, which for me, if we look at our rule out diagnoses down here, Things that can be acute, uncharacteristic. Usually ADHD, that's been going on for a while. He's 27 years old. Usually folks with ADHD kind of all of a sudden this acute instance where he's making others laugh, cracking jokes, being uncharacteristic. Usually this would have come out early on in ADHD, so that's really not on my radar. However, for example, bipolar disorder or something, bipolar, schizophrenia, these are more so in the running right now as being possible diagnoses, just because these conditions, these disorders can come on in very sudden, have an acute phase, and they involve kind of uncharacteristic behavior or even odd or strange behavior. And so, other ones such as histrionic and borderline, he likely would have shown these. This is, these type of histrionic and borderline, these usually are long-standing type of disorders. The characteristics have been going on for quite some time, and so those two are kind of falling off my radar at this point, just because of the fact that this sudden change is all of a sudden happening and it's uncharacteristic, whereas ADHD, borderline, histrionic, people would have usually have noticed that throughout a good portion of his life. So let's continue on, but it's looking for me right now kind of bipolar-esque, maybe schizophrenia, but again, schizophrenia, just as a thought process, is going to require bizarre or odd delusions and hallucinations, hearing things, seeing things, smelling things, all of those type of things, as well as possibly delusional type of thoughts. So let's figure out if hallucinations are on board. That's pretty unique. But for right now, let's take a look. So here we go. It looks like let's continue on. Looks like he's started flirting with several women around the office and making sexualized comments about their appearance, which again really is speaking to this uncharacteristic. If he was mild-mannered, reserved, and all of a sudden he's making sexualized comments about women around the office, that's definitely uncharacteristic. Hypersexuality is oftentimes very key and very common symptomatic or symptom of bipolar disorder. And so, that's definitely tipping me towards that much more at this point. Let's see. And it looks like no one in the office has seen him this way previously. So again, this speaks to this acute phase and uncharacteristic. As you can imagine, here's this mild-mannered person now making jokes, singing lines from musicals, making sexualized comments. So this is really out of character. And it looks like Jeff has been talking nonstop about some exciting ideas that he's been thinking of over the past week. So there's some critical points right here to put out. So let's see, Jeff has been talking nonstop. So if we talk about kind of pressured speech, that is pretty kind of talking nonstop. Pressured speech is one. Let me put it down here. So pressured speech is definitely something to go along with bipolar. It can cross over into schizophrenia. Some exciting ideas. So here we have like ideas going on. Exciting is a key word that he's been thinking over the past week. So this statement here lets us know that we have about 7 days, it appears, 7+ days, that he's been going through this kind of thought pattern, or at least maybe these type of behaviors. So this gives us quite a good time frame that if we are going for bipolar, we're talking at least a week's time frame, which is what we need. Let's see. So it's a week time frame, 7 days for a true manic episode. So as we know, hypomanic requires about 4 days. If it gets to 7 days, we're well within the range now of a true manic episode, like a bipolar 1 at this point episode. So this timeline really helps out that it's been going on for a week. And it says that these ideas, it looks like he's saying that will revolutionize the business world. Now this is key statement here. When we hear people talk about revolutionizing, this word revolutionize really has a lot to do with grandiosity. So this idea that they know more, they've now become, really important in the world of business, and they've stumbled across something that's going to change the business world. It's never been thought of. So this is kind of a really kind of interesting phrase that really lends itself to this grandiose idea of revolutionize. So if you hear revolutionize, that's a pretty good idea that we're on track for some sort of manic or definitely delusional type of thinking. It goes on to say that he's told them that he's come up with a grand theory. That's kind of an interesting statement as well. So grand theory of business that will make the market run so much more efficiently. So I've heard this over my career, that oftentimes this grandiosity then speaks to their idea that they can make things run so much more efficiently if only their idea were in place. And it's a grand theory, meaning like they're making connections to huge ideas that are going to revolutionize and again make things run smoother, change the world and the way things run. So this idea of run more efficiently is pretty kind of a common theme within bipolar, kind of especially kind of mania and hypomania, is they want things to make these smooth connections and efficiency connections to make things more effective. Let's continue on. It looks like because of his enthusiasm and excitement, so here we have like increased mood, elevated mood, so those couple of more criteria that lead us towards bipolar disorder. Looks like his colleagues have attempted to ask him about the details of his plans. However, his speech is so fast and garbled that they have trouble understanding what he's talking about. So this is very common in bipolar, is rapid speech, pressured speech, meaning that it's coming out faster than they're able to really kind of get across the words, that it's really coming out kind of garbled. It's oftentimes tangential, disorganized, to the point where it really kind of makes no sense when he's talking to other people. They're jumping so fast, and they're seemingly making connections in their head of what it means, but people on the outside have really no clue what they're trying to get at, the lack of details. And then it says he mentioned that he's attempted to contact several Fortune 500 CEOs and the director of the New York Stock Exchange to share his revolutionary ideas, but has been unable to get through to them. So here you have this grandiosity that's attempting to now even, he's going above and beyond. He's making calls to big people in the industry to try and tell them about his ideas. So this is really progressing now. So let's jump down. It looks like his work at the law firm's begun to suffer, and his clients have begun to complain to his superiors that he's not returning his calls or completing the work that he's contracted. So this lets us know definitely that his work is suffering, and it's having an impact on his job and his clientele, his kind of interpersonal relationships. So here we have whatever's going on impacting his job, his interpersonal relationships, kind of being able to socialize. It's actually impacting coworker interactions as well. And when confronted by his supervisor, his desk was covered in articles about business and economic theory. So here we have disorganization going on in his office. It looks like the papers had words and comments written on them that did not make sense. When asked by his supervisor what the papers meant, he responded, excitedly that he found a unifying connection between the global business market and the economy. So again, this unifying connection, he's talking about these grand ideas. Upon leaving the office, it looks like Jeff's supervisor contacts Jeff's wife to express his concern about his strange behaviors, which again kind of leads us that this is uncharacteristic, and asked if everything was okay. Looks like his wife responded by saying that she noticed that he had been staying up late, or staying up over the past week until 3 or 4 in the morning. So that's a huge red flag that we have, 3 or 4 in the morning over the past week. So this really speaks to kind of almost insomnia type of, or lack of sleep, which is typical with bipolar disorder and kicking them into like a manic phase, or certainly symptomatic of a manic phase, is when they stop sleeping or need very little sleep to get going. It looks like he has, he's been on the computer all night, working nonstop, it looks like, mumbling to himself about an amazing discovery. So back to this kind of grandiosity, this big ideas and plans. Let's see, in the 2 years that they've been married, she said that he has had moments, and this is critical, he's had moments where he would get excited about certain projects and ideas. So that almost speaks, again, that this is something that may have happened previously, but the ideas and projects would eventually fizzle out, or he would lose interest. So this is kind of interesting. If there was kind of a possible description for maybe previous hypomanic episodes, it would be this, that he would get excited about projects and ideas. So here's this elevated mood, this energy, goal-oriented behavior, all of these characteristics of bipolar disorder, or at least hypomania, like bipolar 2 was likely happening, but the ideas or projects would eventually fizzle out, or he would lose interest. So, which is pretty typical for like hypomania, is that they get excited, get going, and then things kind of fall apart, or they lose interest, which is kind of similar to ADHD type of behavior. Again, that kind of, it could speak to that, but ADHD would have been present long before then, and has some different characteristics. Then finally, she responds that Jeff has never acted this way before, and she's become worried about his recent talk about needing to take out a second mortgage on their house to pursue his revolutionary business plan. So now essentially saying that she has become worried. So it's impacting the marriage at this point, the relationship. So that's another area that's, becoming jeopardized by this current or recent behavior. And he's also wanting to kind of risk taking at this point. He's wanting to possibly invest or take out a second mortgage to pursue this business plan that really obviously is very garbled, doesn't make much sense. So he's willing to kind of, it seems, be impulsive and, invest a large sum of money in something that really has not really conceptualized or operationalized, at least that we can understand, or that people understand here. So let's break this down really quick. As far as diagnoses, rule out. First of all, a couple of things. It doesn't say anything about, substances, so we're going to cross that off. Any sort of medical, we don't know, so that might be worth a referral to, the PCP to get him checked out. I mean, if this is something very acute, uncharacteristic, you definitely want a referral to a PCP to figure out possibly what is going on here. So we can't necessarily cross out that it may be due to some sort of medical condition. We don't know. So let's keep that there. ADHD, as I said, I'm going to go ahead and rule that out, just for the fact that it probably would have been mentioned long ago, plus these different grandiose ideas, some of these other things, the grandiosity, the impulsivity, as far as, the sexualized comments, the singing, the talking, the uncharacteristic, really is going above and beyond what ADHD would normally be like. And again, it likely would have been present long before schizophrenia. I'm going to take that out of the running for the fact that it didn't mention anything about hallucinations or those type of behaviors that would have lent itself to schizophrenia. And again, I already spoke to histrionic and borderline. This would have been much more long-standing. People would have noticed before. His wife would have likely noticed those type of long-standing personality traits. So I am going to land on that this is definitely a manic episode. It's not showing any signs right now of any sort of depressed mood or changes in depression. The wife doesn't describe any previous depression. So I'm going to put it as, let's go ahead and write this down. I'm going to put it as a bipolar 1 current episode manic. And I'm going to put this, as far as severity, it's definitely kind of pushing, it's jeopardizing his job, relationships. It's not necessarily needing hospitalization at this exact time. However, it's definitely moving down that road. So I would definitely put it towards the moderate end, in that it's possible job loss affecting possibly his marriage, bigger financial decisions. So moderate, leaning towards severe if he starts to, have any sort of psychotic symptoms that go along with the grandiosity and delusions or these type of behaviors. Definitely at this point, he needs to be seen as far as treatment plan goes. I would say a referral to a PCP to rule out medical conditions. So let's not forget that my diagnosis, at least my provisional, let's put it that way, provisional would be bipolar 1, current episode manic, moderate at this point, headed towards severe, just depending on how things are playing out. I would definitely say, as far as a medical condition, refer to the PCP to rule out any medical. I would also likely let the PCP know, or the wife know, that if it comes back everything's clear from medical, likely a appointment with a psychiatrist, some sort of likely mood stabilizer or antipsychotic to address the manic phase would be critical at this point in order to save his career, relationships, all of that, to get things back stabilized. As far as treatments goes, therapy would be recommended, psychoeducation to help him understand what's going on, explain some of his symptoms and some of his bipolar kind of manic traits, if that's what this truly is, and help educate him, as well as then some, I would say, kind of a lot of psychoed for this person, at least in the beginning. And then from there, make sure they're taking their medication, and following up with medication management would likely be the best. I would also get the spouse on board to talk to her and maybe do some couples counseling a little bit, with more of psychoeducation of how she can support him and how he can communicate with her. So that would be my treatment recommendation and diagnosis for this particular case of Jeff.